In this presentation, I will talk about the etiology of the periodontal disease and specifically the external factors that will lead to a periodontal disease, or as they also known as the environmental factors. Before that, I want to make a fast review about the pathogenesis of the periodontal disease that depends on three things: the presence of a periodontium, an irritating factor, and an immune response to that irritating factor. And because we have the periodontium and the immune response already, so that we need an irritating factor to start the periodontal disease process. The irritating factors are two, either external factors or environmental factors that I will talk about in this presentation, or internal factors. The internal factors are subdivided into two types, which are the local factors, including the dental plaque, and the factors that will enhance its accumulation and retention, and the systemic factors, including the systems of the body that reach the periodontium and affects them, which are the blood and the immunity in the blood and the hormones in the blood, and of course the genes that are present in everywhere. These are the systemic factors that will lead to or affect the periodontal health. The external factors, on the other hand, are divided into three categories. Category number one, which include the biological factors, the non-habitant biological factors, which are the bacteria, fungi, and viruses that live not permanently but temporarily in the human mouth and then go away. Okay. The second category, which include the chemical factors, which are some types of the medications, some types of metals, and some of the dental products. Also, some food related factors, tobacco use and smoking, and stress. Finally, the physical factors category, which include the radiation therapy and traumas. Some kind of bacteria, for example, the syphilis bacteria or the gonorrhea bacteria, will have some oral manifestations as a periodontal disease. For example, as you can see here in this picture, that there is an oral ulcer that is associated with the syphilitic infection in this patient. Also, the viruses, some kind of viruses like the famous herpes virus or the varicella zoster virus or the human immunodeficiency virus or HIV, all of these viruses may have or show an oral manifestation as a periodontal disease. As you can see here in this in these four pictures, pictures A and B show a 29-year-old man with a primary herpetic infection and severe gingival inflammation, and in picture C and D, 6 weeks after the treatment with a systemic acyclovir that has treated the infection, and also the famous linear gingival erythema. That gingival erythema is linear in shape and is characterized for the patients that are infected with the human immunodeficiency virus or HIV. Okay. The third and last biological non-habitant factor, which are the infection with fungi. Actually, the Candida is a habitant and it is always present in our mouths, but they are opportunistic. When there is a low immunity, they will show up and show themselves in the mouth and lead to a periodontal disease or gingivitis or anything like that. And the medications, which are the first part of the chemical factors. Medications including the famous phenytoin that comes in almost every exam. They ask you what is the medication that will lead to a gingival enlargement, and you choose phenytoin. And aspirin that will lead to aspirin burns, immune suppressants. As you can see here in this picture, that is a clinical images of a 9-year-old boy with severe gingival overgrowth as a result of a heart transplant and cyclosporin therapy. So that, for example, the cyclosporin is one of the immune suppressants that will lead to a periodontal disease, as you can see here in this picture. And the calcium channel blockers like nifedipine, verapamil, sodium valproate, and diltiazem. And the oral contraceptives, and of course the bisphosphonates. All of these medications may induce a periodontal disease. As we can see here in these two upper pictures, A and B, which are clinical images of gingival overgrowth after the use of a calcium channel blocker to control hypertension. We can see the gingival overgrowth, which is very obvious, surrounding the gold metal crowns or bridge. This is a bridge. And also in the lower left picture, we can see the bisphosphonate associated osteonecrosis, and on the right lower picture we can see the phenytoin gingival enlargement. And also some metals may lead to a periodontal disease, which are the bismuth, lead, mercury, and nickel. And as we can see here in this picture, picture A, which is a localized pronounced gingival inflammation in response to a nickel allergy. Pictures B and C shows histological sections of this allergic reaction. Some dental products or part of these products will lead to an allergy or a periodontal disease or whatever. For example, the acrylic, some kinds of restorations like the amalgam restoration, as we can see here in this picture. There is a gingival pigmentation associated with a previous epicoectomy and amalgam retrofil procedure. Some toothpastes, mouth rinses, polishing products, all of these dental products may affect the health of the periodontium and lead to a periodontal disease. Also, some food-related factors, for example, an allergy to a spicy food or a chewing gum. Actually, this case has surprised me. As you can see here in this picture, a generalized severe allergic response of the gingiva in response to an additive in a chewing gum. This case is strange, but it is happening, so that when there is when there is a case like this case, you should take a thorough history from the patient regarding everything he has eaten, he has taken, he has done during the previous days, so that you may know what is the cause behind this periodontal disease. And that's why the dental history and medical histories are very important. Also, the vitamin C deficiency, which will decrease or impair the production of the collagen fibers will affect the periodontium structure negatively and facilitating the periodontal disease process. Vitamin A deficiency will affect the epithelialization procedure adversely and will lead to more easy periodontal disease. And finally, the vitamin D deficiency that will impair the um, bone structure, and of course it will lead or facilitate the periodontal disease process. Also, some parts of the foods like the fish bones or a popcorn, if they are gone inside the periodontium, they may lead to a periodontal disease, for example, a periodontal abscess or a gingival abscess, etc. Also, the tobacco products. Guys, if we use the tobacco only and chew it, it will lead to a localized periodontitis. But if we smoke it as a cigarette, it will lead to three things. The first thing is, as we know, that the smoking will will increase the construction of the microvasculature, and so that it will decrease the amount of immunity that reach to the periodontium, and the food products that will reach the periodontium, making it more weak, making it more susceptible to a periodontal disease. The second thing that has been noticed, that the smoking will enhance the presence of a specific aggressive type of bacteria more than the others, and so that it will not affect the quantity of the bacteria, but it will affect the quality of the bacteria. And the third and last thing or effect of the smoking, that is, it will decrease the amount of the immune cells. It will decrease the efficiency of these immune cells by decreasing the chemotaxis of these immune cells, and finally increasing the toxicity of these immune cells by making them produce the bad types of the tumor necrotic factors and prostaglandins, leading to or facilitating the periodontal disease process. The stress and the periodontal disease. Guys, I have categorized the stress with the chemical factors because the stress itself does not do the periodontal disease, but the stress will enhance or increase the production of a chemical material that is called as a cortisol, that are produced from the adrenal glands. This cortisol will impair the immunity or decrease it, leading to more periodontal disease and facilitating it. Also, the radiation and the famous osteoradionecrosis that is associated with it, because the radiation will kill the cells in the tissues of the periodontium, and it will decrease the amount of blood reaching that area, decreasing the amount of immunity and food nutrients that reach that area, and subsequently weakening it and making it more susceptible to a periodontal disease. Finally, we have the traumas with their three types: the factious traumas, or the traumas that are done intentionally or unintentionally by the patient himself, or iatrogenic traumas that are done by the dentist or a dental auxiliary, and finally the accidental traumas that are done not by the patient himself, not that by the dentist or a dental auxiliary, or accidentally by an external factor like a burn from a cup of coffee. Okay, as you can see here in this picture, a factious Self-inflicted gingival dehiscence induced by the patient's fingernail. That is a factious trauma. Thank you for listening to this presentation. Always try to know, try to spread knowledge and construct the world. Try to be kind to others, and that is for the greatest benefit to the humankind.